The administration bill is H 3200. What I call the good bill by Dr. Price is HR 3400. And so I would point out that we do have provisions for tort reform in HR 3400. I'm an attorney, I'm not bashing attorneys, but I do believe that we can have arbitration. People who are injured due to malpractice should have a right to be compensated. And so our bill provides for arbitration. The reason that it's not in any other bill truly is because of the strength and power of the trial lawyers within the United States. And I actually respect how they understand to work within the political system. Trial lawyers are very active. When they make contributions, it's generally the maximum, $2,400. When doctors get involved, it's what they consider to be the maximum is $25. And so I'm not saying that people are buying influence, but if you are working with the trial lawyers, that does lead to significant campaign assistance, and so then they're elected. And so I would tell you that the reason that the administration does not have any provision, serious provision, as to tort reform is because of the influence of the trial lawyers. They've been active in the Democratic Party. This is not new, for decades, helping fund the party. And I say that respectfully, but we really need the medical community to become involved because the malpractice insurance premiums are so high. What my main concern is defensive medicine, that the cost of medicine is actually increased by about 10%. Because doctors have to do so many different tests under the theory of defensive medicine that if they are sued, that they have to do a checklist of all the tests that they've made. So it really would be beneficial for overall cost and what we're proposing, affordability and accessibility, if we had tort reform, and it's in HR 3400. Well, first of all, I'm very grateful. The evening of the speech, within an hour, I was in touch with the White House, and the White House indicated my communication was accepted. Now let's have a civil discussion of the issue. And I'm very grateful. An issue that I had worked on that I was very knowledgeable about because I'm on the Education and Labor Committee is citizenship verification. And I've read the bill twice. And I knew that the bill didn't really provide for verification. And so I'm very grateful that within 48 hours of the speech that the U.S. Senate adopted citizenship verification. The White House issued a news release indicating that they, in their bill, would provide for citizenship verification. And it's really easy to understand the whole concept of citizenship verification. I relate it to the drinking age and the age of purchase of alcohol. In most states, it's age of 21. And obviously, you have to show your driver's license prior to making a purchase. But in the bill that we had before us, there was no provision of any verification. And so you could have somebody, say, 12, come in and say, I'm 21, claim to be a particular age, purchase alcohol, or in the situation of healthcare, people could just say, I'm a citizen. When they're not. And it's really not that difficult to provide verification of citizenship. Again, it would be a driver's license, hopefully biometric. Additionally, it could be providing a visa status of some type, anything more than nothing. But we do have to watch the bill because even though they adopted citizenship verification, I was really very pleased that, of all people, CBS News, the day after the speech, did a legal analysis. Was Joe Wilson correct? CBS News, that had fabricated the military records of President George W. Bush, came to the startling conclusion, state-run media, that Joe Wilson was correct. They also pointed out that there were extremely sophisticated legal organizations, bar organizations that were actually promoting that there not be citizenship verification. I did not see, and I'm not a conspiratorialist, I did not see that this could be somehow related to ultimately providing amnesty. But there was a direct relationship, and I really This wouldn't be something I say. This is what CBS ultimately determined. Well, I'm really so pleased as we had town halls across the district that I represent. In Columbia, and this is the handout that we had, and it explains the Republican alternative, H.R. 3400. It's very frustrating to me. The media keeps saying we don't have an alternative. Of course we do. And I've been discussing this throughout the district that I represent. Additionally, I expressed my concerns about what the Democrat proposal, the cost of it, the attack on senior citizens, the attack on small business, costing jobs. We have high unemployment in the district I represent, and so people are very concerned. And of course, the very famous chart that we wanted to have distributed that unfortunately Ms. Pelosi actually got with the franking office and said it wouldn't be appropriate to distribute the chart. So I took it to my constituents, thousands of copies. Additionally, different amendments that I was able to have enacted. What I found out, the people I represent want health insurance reform. They do not want a government takeover. And it was extremely significant. In Columbia, we had 1,700 people. That was the largest congressional town hall in the history of South Carolina. 3 days later at Lexington, my home community, we had 1,500 people. 2 days later at Beaufort, we had 1,500. Later that afternoon at Hilton Head Island, we had 1,200 people at town hall meetings. 95% of the people there were for health insurance reform, not government takeover. At each of the initial town halls in August, we had hecklers. I was not particularly thrilled that they were there, but I thanked them for being there. They were hecklers on behalf of the administration. Then this past weekend, we had town halls in rural communities. First time ever for a town hall in Barnwell, South Carolina. In North South Carolina, which is in Orangeburg County for citizens of Orangeburg and Calhoun. And then at Varnville, South Carolina, we had a town hall for citizens of Hampton, Jasper, and Allendale. And all of those were the first congressional town halls ever held in those communities. We had over 100 people at each one. Again, no hecklers this time. People were very concerned. It's been reported that people are angry. No, they're not angry. They're concerned. They love America. They're very patriotic. They're very concerned, the senior citizens, for themselves. They're very concerned for their children and their grandchildren. And so it was really an inspiring circumstance for me to have town halls around the district. But people do not want a government takeover. I've been in parades, and it's really interesting that as you proceed along, people can anonymously say things to you. And so I've been at parades where over and over again people would yell out, "No Obamacare." And I would indicate that I had heard what they said and I appreciated and supported their position. Well, I'm very concerned. The public option, which is the government option, is really a monopoly option. The government would be determining the regulations of how health insurance policies are to be implemented. Then the government would also be interpreting the regulations. The regulations, we know if the bill's 1,000 pages, the regulations will be 10,000 pages. Additionally, if the system were to fail, the taxpayers simply pick it up. But if it's a private company, they'll go out of business. And and there's never been truly a business able to compete with the government. The government has all the advantages. And so I truly hope that we have what we're proposing, H.R. 3400, which is health insurance reform. But if we don't, if they do include a government option, I see it as catastrophic for the American people. It simply will not work. We've already seen cash for clunkers. It'll be overwhelmed. And it was an inconvenience for people not to be able to buy a car. But it will be life and death if people go to the hospital and they simply can't even get out of the parking lot. And so I really hope that we can have health insurance reform. I'm very concerned that the President, Ms. Pelosi, Senator Reid, seem obsessed with just passing a bill. But the American people have already made a difference. And if they will contact Democrats and Republicans and express concern, further changes can be made. We already know that H.R. 3200, that the Democrats meant for that to be presented to us on July the 14th and to be passed by July 31st. But the American people intervened. They've already been successful, and they stopped the bill, and it's still being discussed. But that's not what the Democrats had in mind. So the American people have made a difference. When Governor Palin brought up about the conflict of interest with the end-of-life provisions, it is a conflict of interest. I have been a probate attorney myself, and the thought that the government would be intervening and giving advice, the conflict of interest is the government would be looking for the least expenditure, not providing for people to live longer. This should be a decision not of the government, it should be a decision of the patient, the doctor, and the family, possibly with legal advice, but not government advice. And so that's been blocked. And then another bit of success for the American people is the full intent was for the government option just simply to be there. But depending on the day, the American people have made a difference. One day they say it's in, one day they say it's out. Sometimes it's in the Senate bill, sometimes it's not. The American people are making a difference. And so I'm very, very hopeful that they will stay engaged. We have the elections coming up in New Jersey, in Virginia on November the 3rd. Those are crucial. If the American people turn out and they make changes in terms of governorships, if they make changes in terms of the legislative races, this will get the attention of Congress and can have a really positive effect of working to get health insurance reform, not a government takeover.